Well, David, thanks for inviting me to your great country and allow me to exchange some ideas with you and other colleagues whom I've met during my visit to Prague. I want to describe what really the path has been for me during the past 50 years of my life. I went to medical school expecting that I will be dealing with a lot of sciences like chemistry, physics, mathematics, because I was very good at those in high school. And I talked to my high school teachers. They say, of course there's science in medicine. And I go to medical school in Tehran, my capital city in Iran where I was born, and I realized that there is no science in medicine. And that really bothered me immensely. I read the books, textbooks, took past exams, but that's the extent of my dedication to medicine. And I was looking really to go back to my high school science classes somehow. Those days, we had a great relation with America, and a lot of graduates of medical schools used to go to America, and I applied for an internship and residency at the community hospital in Philadelphia. And I was just wandering around in the hospital. I realized that there's a section called nuclear medicine, and there's a Mendeleev chart on the wall. And I talked to people there. They said, we use radioactivity in medicine. I said, this is why I came to medicine to do. You know, this is exactly my aim, to be able to use modern sciences in medicine. And unfortunately, over the coming few years, I was able to go to the University of Pennsylvania and get enrolled in the training program in nuclear medicine. This is the 1971 when I started my training in nuclear medicine. My mentor was David Kuhl, who was the person who invented tomography. But he was doing SPECT with technetium compounds. We were looking at blood-brain barrier in patients with tumors, with metastasis, with stroke. And so we were very happy that we were doing something that was very novel at the time. And then in 1973, we got the first CT scan in the country to the University of Pennsylvania. We started comparing what we were doing at that time with the SPECT, namely technetium-labeled tomography, with CT findings with contrast-enhanced CT. And it was very clear that contrast-enhanced CT was going to do what we were doing with technetium-labeled SPECT imaging, which we didn't call it SPECT at the time, we just called it tomography. So I was doing actually 10 brain scans with the SPECT before CT came. Within 2-3 months, those 10 became 0. Everybody was sending their patients to CT scan, and that really was very just annoying to us and very disappointed that here we have the first tomographic unit with radioactive agents, and it's just going away. So we decided to survive and to do something that relates to radioactive agents, but with a different approach. We were working with colleagues in neurology who were doing C14-deoxyglucose in animals, and injecting animals with C14-deoxyglucose, and then making what's called autoradiography. And it was just clear that C14-deoxyglucose mimics glucose. We could see gray matter, white matter, and that really started us on the path that I have followed. This is really 1973. So during the past 51 years, we really changed the path from doing conventional nuclear medicine with single gamma emitters to something that appears to be revolutionary and most powerful modality in medicine. So we talked to chemists at Brookhaven National Laboratory, made first fluorine-18 deoxyglucose, brought the deoxyglucose by plane from Long Island to Philadelphia, and I did the first human studies for whole body as well as tomography with our SPECT machine. And of course, PET machines became a reality soon thereafter, and truly what we have seen over the past 50 years a tremendous change the way that we practice in our specialty. So in my view, of course, FDG shown so much promise. We doing so many, 8 different applications for FDG has led to installing cyclotrons in major institutions and attracting a lot of basic scientists, chemists, physicists to our field, and also attracting a lot of young physicians who are looking for exciting stuff, and they cannot find it in conventional medicine. For sure, in radiology, which is purely looking at structural imaging. So really, this has been an incredible journey for me as a physician who really wanted to do something that will be exciting, very creative, helping mankind. So really, this specialty is the most powerful specialty in medicine as far as I'm concerned. We have not only developed multiple traces, there are 2,000 compounds that have been made with PET, and the sky is the limit. And not only, of course, in radiopharmaceutical areas, but also instrumentation. Now we can look at the entire body in 2 minutes total body PET machines. So really, I believe that the impact of PET is going to be greater than any other modality in medicine. We're going to understand the best way to diagnose molecular aspects of the disease in animals, in human beings, and above all the drugs are going to be developed by PET. SmithKline, which is a major drug company in our area in Philadelphia, has 10 PET machines. They're testing every drug by PET imaging. So there couldn't be any major resolution in medicine than what we have been able to accomplish with PET. And I will really encourage, as I will discuss during my presentation, about really interaction of colleagues within the universities as well as with government agencies. We have to push in Czech Republic advancement of PET in every level, from attracting medical students all the way to talking to administrators, to make it possible for us to establish a lot of PET centers in every medical school, a lot of cyclotrons in major centers, and make this a reality as Germans and Americans and Scandinavians have done. There is no reason why Czech Republic, with a lot of talented people, could not do what other countries have done. Thank you for invitation to visit your country, David. I'm very grateful to you. I've enjoyed it immensely, and I'm looking forward to working with you and other colleagues in the future. If there's a need for it, I'll be happy to really just consult and help in any way I can. Thanks again.